So patient asks about the stage of arthritis and when they should be operated. So once the pain is affecting their activities of daily life and X-ray is showing irreversible changes in the hip, that is the stage where patient should be operated. That's medical science says, and it's not urgent surgery, but certainly patient can plan their surgery. It's a elective surgery, unlike the fractured neck or femur where we go for hip replacement on the early basis. The routine total hip replacement done for arthritis is a highly elective one. So patient can time their surgery. And second question is how it is done. That means one is conventional one, where we do the proper opening of hip joint and we replace the hip with the artificial joints. Other is a minimally invasive, and the newer one being the direct anterior approach, which is considered to be the faster recovery one. And technology wise, we can also tell it's a conventional or either it's a technology based, where we use the navigation or robotic one. Again, the patient asks which one is the best. So I would like to tell them the results of each and every one. Properly done conventional surgery and the newest one, that is the robotic one, the long term outcome being the similar one. There is no substantial difference in their longevity or the re-revision rates of these kinds of surgery. So let your doctor decide whichever is comfortable for him or her should be the ideal one for you. Thank you.